You are my closest friend. My strength in days go mad. But I spend my time in shallow sheets. I should have seen your hand. Hey, Amy students, we're going to kind of wrap up notes today. Talking a little bit about the pathology of the heart, some things that can go wrong with the heart. We've talked about the structure. We talked about how the heart beats, the physiology. Just kind of wrap things up, I want to talk a little bit about murmurs, heart attacks, and arterial sclerosis. So that's the three main topics we'll kind of wrap up notes with. Pretty simple. A heart murmur is an irregular sound of a heartbeat. You hear a gurgling sound. It sounds like somebody mumbling. That's the name heart murmur. It can be caused at birth or it can be developed later in life. The thing you need to understand with a heart murmur is most of them are harmless. If they're really serious, they got to be treated with medications, and sometimes they got to go in and put new valves in. And what's interesting is sometimes they put pig valves in, which is kind of a fascinating thing. But a heart murmur you should be able to hear. So a doctor, when you move that stethoscope around, they're listening for that normal heart rhythm that we talked about in last notes. And they should be able to hear that and not hear a backflow of blood, a gurgling sound. Let me kind of show you what we're talking about. So here is a normal heartbeat. So listen closely to this. Now, almost sounds like there's a gurgle, but there's not. It's just kind of an echo there. Okay. Now, let's kind of look at what it would sound like in a abnormal. This is actually a 16-year-old who has a heart murmur. So see if you hear the difference. Hopefully you heard that kind of backflow, a little swooshing sound. For the most part, we don't have to do a lot with that. Just sometimes they do if it's really serious and causing some mixing of deoxygenated and oxygenated blood together. The second thing I want to go over is arterial sclerosis. Hardening of the arteries is a common term for that. Plaque builds up in our bodies. Fats especially don't break down real well. And that's when they say plaque, that's what they're referring to. What it can do is restrict blood flow. In some cases, actually break loose and cause clots and strokes and some other things. So arterial sclerosis is not just a heart disease. It can be other things as well, especially a stroke risk and things like that. And remember, these coronary blood vessels are about the size of a ballpoint pen refill. So it doesn't take much to clog them. Here's a good illustration. You can see this plaque builds up. And if this gets narrow enough through here and we get 70% or higher blockage, then we got to go in there and do something to fix that. Okay. Diet will help with this. Exercise, watching what you eat, fatty foods. I have to do that right now. I'd be careful with fatty foods. And exercise helps as well. And some people are just more prone to it with genetics. That's a component of it as well. Now, there's three ways we can fix that. So when you hear someone having a bypass, that's where they make a little incision. They take another blood vessel from another part of the body, bring it up and around, and suture it in down here. And they literally just divert the blood flow into the other blood vessel. It's like a detour in the road. And you totally skip over this blockage. If you hear someone has a double bypass, triple bypass, quadruple bypass, that just means they've done that in 4 places or 3 or whatever. Okay. Another way of doing it is an angioplasty, where they actually put a balloon in there and inflate it and blow the plaque out of there. And then you have what I'm going to show you a video on is a stent, where they actually put a collapsed metal tube in there. I'll show you a video. They put it through here. They'll put a guide wire through here. They'll bring it in. It's compressed. They inflate a balloon the same way they would with angioplasty. It expands the mesh, blows the plaque to the walls or smashes it to the walls, and then you got a metal tube where blood can flow through there again. So let me show you the video on that. turn down the music. The music's kind of interesting. Okay. So I kind of talk through it because there's no commentary, but they literally will go up in through the inside of your leg usually. They can go inside of your arm as well. They follow the blood vessels back up into the aorta and into the coronary arteries. And they literally will then put this kind of like a guide wire that they follow up through there. Think of like a train track. And they'll find the blockage. They have a big screen they look at. Same thing as my heart catheterization that they did. They go in to where the narrow opening's at. There you go. So they're bringing this in. Then they're going to bring in a stent, and it's collapsed at this point with a balloon inserted in it. They inflate it. The mesh goes out, and then they deflate the balloon and pull it back out. Now I got a metal tunnel for blood to flow. Pretty cool. Okay. So that's just another way of fixing a blocked artery. So lots of ways they can do that. The good news is that they're doing this a lot with they're doing this with what's the word I'm looking for? A lot less invasive type of technique. Okay, so that is, quicker recovery time and that type of thing. The last thing I want to kind of go over is myocardial infarction, which is a fancy name, aka heart attack. Myo means muscle, cardio means heart death. That's just caused by what I just showed you. Okay, so if it gets bad enough and the plaque gets bad enough, then a buildup occurs and you have a heart attack. Now, the problem with a heart attack is a lot of times the heart will heal, but the problem is you get scar tissue left behind. If you get scar tissue left behind, it doesn't flex like normal heart muscle does, and you're going to have restricted heartbeats, and you're not going to have as efficient a heart as you would without the heart attack. So that's why we like to do a lot of preventative stuff. I talked about this earlier in class. You need to get out there and get things checked out if you're having a heart issue and get ahead of this so it doesn't result in this. Okay? Hopefully that makes sense. We have a test coming up, so study the notes. I'll have a Kahoot game. Actually, I have a Kahoot game today, and we will move on to CPR, which is a great lead into CPR and first aid training that we're going to be doing in the next couple of weeks. All right, hey, have a great day, and as always, if you have questions, shoot me an email. I'll talk to you later. See you. Bye.